Work is underway in Texas to recruit the psychologists of the future. It comes as experts take a hard look at where the state is falling short when it comes to mental health care. Suicide rates have been on the rise in Texas for more than 2 decades, and mental health battles claim the lives of more than 4,000 Texans every year. And still, we rank last in access to care. I want you to take a look at this map that underscores the dire need across the state. The counties in orange here are the only ones that do not have a shortage of mental health professionals. It's just 6 out of the 254 counties in Texas. But there is progress. I had a chance to speak to some of the experts who are finding innovative ways to get help to these communities. For the Texans at the forefront of the fight for mental health, it's personal.
I have seen firsthand how much suffering is experienced by people who don't have access to mental health services.
In Texas, that's a lot of people. Of our 254 counties, Dr. Berg says 246 are considered underserved in mental health care needs. 137 have not a single psychologist. 32 have just one. That's worse than every state in the country.
Texas is a proud state, and we should not rank 50th in anything.
At Thursday's hearing, the board in charge of licensing psychologists described more bureaucratic barriers that they fear will make matters worse.
I don't think we've ever seen such a threat for our ability to license psychologists in this state.
Bilamowicz says the nation's only licensing exam company is now requiring a second test. A tremendous additional cost, he says, and one that will lead to fewer psychologists, not more.
We don't need to be making the barriers higher and harder into this profession for people. The ability for somebody to have access to mental health care is often the difference with life and death.
Last year, the legislature dedicated $3.4 billion to expand capacity at state mental health facilities. Dr. Berg says that's a good start.
And it's almost artificial to talk about mental health when we are really talking about improving the health of our entire community across the state.
In April, Governor Abbott announced $34 million will go toward building a new behavioral health campus in Uvalde. That facility will have a dedicated wing for younger patients, including a crisis unit for children and adolescents. It's scheduled to open next summer. Lawmakers pushing for transparency and accuracy. The new work at the Capitol to help victims get money the state owes them as they recover from violent crime.